My name is Dr. Ken Alleyne, a sports medicine and joint reconstruction surgeon. And we have a series of videos that we're going to discuss some of the more common things that we see here in my orthopedic surgery and sports medicine practice. By way of background, I am a board-certified orthopedic surgeon. My training has occurred at many places around the country, including Williams College, Medical School at Wake Forest University, Howard University Hospital for residency, Yale University for my sports medicine fellowship, and then a research fellowship at Harvard MIT in Cambridge. The majority of my practice are problems of the knee and shoulder, and our practice here at Eastern Orthopedics and Sports Medicine ranges from school-age kids to active seniors, professional athletes, collegiate athletes, and Olympic athletes. So we have a pretty diverse practice. What we'd like to do today is discuss a series of the more common things that we see in hopes that it will help to direct our patients in their care, to ask the appropriate questions of their doctor, and to make sure that they have good information in regards to their orthopedic concerns. Problems of the rotator cuff are a very common issue found in many orthopedic surgeons' practices, and very common in our patients, from school-age patients participating in sports to our active and not very active seniors. Generally, patients begin to note pain in the shoulder. Some of the other very common symptoms are pain at night, pain with lifting, pain with overhead activities, and pain with reaching. These are the most common complaints that patients present to our office with when the diagnosis is that of a rotator cuff injury. We generally start with a very good history and physical, and the physical exam will put your shoulder through several maneuvers, some of which unfortunately are painful, in helping us to diagnose the problem. In addition, we'll test strength in the shoulder, because one of the hallmarks of a rotator cuff injury is loss of strength, in particular in comparison to the other shoulder, assuming it's not injured as well. Once we have a diagnosis of a rotator cuff disease, and this often is accompanied with an x-ray that you'll have either at the office or before the office visit or after the office visit, once we have that diagnosis, there are many forms of treatment. But before we discuss treatment, let's talk a little bit about what exactly the rotator cuff is. The rotator cuff is a group of 5 muscles that surround the ball and socket joint of the shoulder. As many of you know, the shoulder has an amazing range of motion, and that is because of the unique configuration of this ball and socket. What gives the shoulder its strength and motion are the muscles that insert around the ball and socket. In addition to the muscles are various ligaments, but that's for another discussion. As you can see here, the rotator cuff kind of comes over to the side of the ball and inserts right on the very edge of the ball in an area that we call the greater tuberosity. This area also operates under another anatomic region called the acromion. The rotator cuff tendon, as noted here, often can be squeezed between the acromion bone, which will develop some of the bone spurs or osteophytes that you may hear your surgeon mention, and the humerus, or the ball of the ball and socket. Sudden activity or years of activity of this tendon being pinched between these two structures can ultimately lead to a rotator cuff tear, literally a tear in the rotator cuff tendon. Now, as with many issues in orthopedics, that tear often is going to be diagnosed by a good physical examination and history. We will often supplement that with x-rays, as I mentioned previously, and an MRI of the area to not only help us define potentially the size of the rotator cuff tear, any other ancillary problems in the shoulder, such as ligament issues, cartilage issues, a loose piece floating around in the shoulder, and to help us with any potential surgical planning. Generally, treatment of a rotator cuff problem starts at least with non-operative care. Things like physical therapy, anti-inflammatory medications like Motrin and Advil, and please note, Tylenol is not an anti-inflammatory medication, or the prescription anti-inflammatory medications. Of course, these medications should only be utilized in consultation with your physician. In addition, we will sometimes use the so-called cortisone shot, although we don't really utilize cortisone any further. There are other medications that we tend to use for this injection, and that injection really should be and can be done without significant pain. In addition, physical therapy is a very important part of rehabilitation for a rotator cuff injury. And that therapy is not just exercises. Your physical therapist has a lot of information that they can impart to you to help your shoulder, as well as treatment such as electric stimulation, ultrasound, stabilization and strengthening procedures for the joint that can actually help diminish the pain of a rotator cuff injury and sometimes keep patients out of the operating room. I often tell my patients that it's usually not any one thing, but a combination of many of the things that we do that help to manage a rotator cuff tear and potentially keep it non-operative. In the instances when a rotator cuff tear does require surgery, that surgery, at least in our practice and in any board-certified sports medicine physician's practice, is usually done arthroscopically. By arthroscopic, we mean very small incisions that are made in a few areas around the shoulder, generally about a ½ inch, going inside the joint with a device not dissimilar from this, that's attached to a camera and a large screen where we can see inside the shoulder, visualize the rotator cuff tear, and use other instruments to repair that tear. These surgeries tend to be same-day surgeries, meaning that patients go home the same day. The anesthesia for these surgeries can vary greatly, and that really depends on your surgeon's preference, your health status, and the preference of the anesthesiologist with whom you're working. In our practice, we tend to do these surgeries under what's called an interscalene block. And by that, the anesthesiologist will place medication here at the base of the neck that will numb the extremity. In addition, the patient will be put to sleep and sits in what's called the beach chair position, and that is a positioning much like how I'm sitting now, where you will be asleep while the surgery is carried out. When you awaken, you should have really no pain in the shoulder. You'll be in a sling, and you'll remain in that sling for approximately 4 weeks. Depending on your surgeon, some will see you during that 4-week period. Others will give you instructions for how to manage during that 4-week period until your follow-up visit. At the end of 4 weeks, and again, for some surgeons it may be longer, some surgeons it may be less time. At the end of that period, you'll begin physical therapy, which is usually a prolonged course. Generally, I would count on at least 3 months of physical therapy at 2 to 3 times per week, depending on your individual condition. And like other physical therapy, the most important aspect of that therapy is what you do on your own at home. Now, in terms of return to activities and work, most patients can return to a desk-type job a couple weeks after surgery, at least in our practice. Jobs which require significant lifting and reaching may take several months. And again, this should be discussed with your surgeon at the time of your visit in the office. We often encourage our patients to really come with a list of questions, and we're more than happy to answer those questions in addition to instructional videos like this. Most patients with rotator cuff problems and rotator cuff tears that require surgery do make a full recovery. Now, you may note some differences in your shoulder versus the other shoulder, because once a shoulder or any joint has had surgery, it's never quite like it was before. But we have thousands and thousands and thousands of patients around the country that see orthopedic surgeons every year for rotator cuff problems who go back to their full activity that they had, including very high-level sports, without any pain and excellent function. Should you have any further questions, please visit us at www.eosm.net. Thank you.